Good afternoon. I'm Matt Gibson, President and CEO of Siskin Hospital. We have been working diligently for many months now to minimize the effects of the COVID-19 pandemic on our organization. At the helm of many of these efforts is Curtis Powell, our Vice President of Quality. Curtis has agreed to sit down with me today and talk a little bit about our ongoing mitigation efforts. Just appreciate everything you're doing to lead our pandemic response effort, and appreciate you carving out a few minutes to talk with me this year. And I don't think any of us thought back that 1st of February that we'd be sitting here at Christmas still absolutely in the midst of it, but we are.
We have a mission and a calling here at Siskin, and our first and primary focus is not just to provide quality care, but to provide safe care. And that is truly the heart of what we are doing.
I agree. Mission is the motivation. How many tests have we conducted thus far here at Siskin Hospital?
Nearly 8,000 tests so far, and that is a phenomenal amount of testing to be done, and yet our positivity rate is less than 1% on the total. So when you consider what the community is doing and what our percentages have been, I think that we still are maintaining very well.
Yeah, absolutely. And you know, the exact number, if I recall correctly, you mentioned was 8,600 tests. That's a big commitment for our organization and something that we're continuing every day. It's a really important part of our response plan. I know our clinicians have been wearing eyewear for some time in the patients' rooms and so forth, but now the requirement across the board for any of us anywhere on any of our campuses to wear eyewear.
It is merely an extra protection mechanism. As I've stated before, the CDC has indicated that you can get COVID through the eyes if there's any type of a cough or an aerosolization. Some particle gets into your eye, it then goes down through your lacrimal duct, and once it gets into your nasal passage, it's in your respiratory system at that point. This is just an added measure. By adding the goggles, it is just an added measure to help protect all of our associates from getting COVID. And again, the most protective measures that they can do is to not only mask, but to do the hand hygiene, because we touch our faces all the time without recognizing, as I just did. The hand hygiene is absolutely essential.
And you emphasize a point that I want to remind everybody of. Our strategy from the beginning with our mitigation plan has been multiple measures, putting multiple measures in place, often erring on the side of precautions, sometimes extreme precautions, to put us in the best position to minimize transmission of this virus. And it's all about multiple measures. Everything that we're doing as far as screening and tracing to, again, all the different measures across the institution. There will likely be more measures implemented, whether they be this week or next week, but as we continue to fight this pandemic.
Now what we're doing is it really is all evidence-based, and that's what we're following through with.
Constantly something we do is sourcing what other organizations across the country are doing, other inpatient rehab facilities and also other hospitals, and talking to our national advocacy and other groups, the American Hospital Association, the Tennessee Hospital Association, the Tennessee Department of Health, the American Medical Rehabilitation Association, and our local hospitals. I speak to the local CEOs 3 times a week. We have a call, standing call, so that's a part of our mitigation strategy too, staying in close communication about the measures that are being implemented and proven elsewhere.
And if it feels that we have gone one way and then gone back another way, it's because the evidence that we first had may have changed, and evidence is changing. We are being very intentional, and it truly is based upon research, sound research.
Well said. And there are major implications of this virus and how we handle this virus for this organization, and the fact that we have been so effective, relatively speaking, in comparison to peers in different geographies such as the state, the county, the country, has enabled our organization to more fully fulfill its mission. It has enabled us to continue to care for patients, which has not been the case consistently for every other type of organization, long-term care facility, other post-acute facilities. So I'm grateful for what our associates are doing on a daily basis. I'm grateful for what you're doing, because it's enabled us to continue to fulfill our mission. And everyone needs to understand that the stakes are high, and that's why we've been so aggressive with our mitigation plan. Tell me a little bit about the vaccine.
The vaccine is a modified RNA, mRNA vaccine. And what that means is that they took a look at the actual COVID virus, and every virus that attacks has a very specific protein molecule on it that the body sees and says, ooh, that's an enemy, and will develop the antigen or the antibodies against that particular protein. So the vaccine is not, it's not COVID, it's not attenuated COVID, it is not the virus itself at all. What they've done is they've actually developed the protein, so that by injecting just that protein, your body will develop the antibodies, and therefore, if you do come in contact with COVID, as soon as it sees that protein, it's going to immediately attack it and kill it. It will not have any chance of growing and replicating within your system.
So Curtis, tell me a little bit more. I understand, obviously Siskin Hospital is going to have some access to this new vaccine, which is very exciting, here in December. Tell me a little bit more about what we know today. I know this has been evolving with the federal government, but what we know today about our access in December, and then I know we're going to be getting more in calendar 21 as well, early 21.
We know that the state is allocating out to various hospitals as well as various health departments the vaccines. We do know that allocation-wise, the hospitals are going to be receiving the Pfizer product, and the Moderna product is going to be going to other smaller facilities. We fall into that, as well as other agencies that are healthcare related. How much we get, but we do know that it will be available to some extent by the end of the month.
Yeah, that's very helpful. In those categories you alluded to, the state and across this country, there's clear categories that denote the highest risk. So there's 1A, and then it moves to 2 and 3 and 4. So we'll be communicating with our leadership team and our associates as we get more definition about the exact number that Siskin Hospital is going to get in this first category of 1A in the next few weeks. So very exciting to have that coming to fruition and getting all the necessary federal clearances through the FDA and other bodies. So very exciting. We are still absolutely in the midst of fighting this virus. But of the results we've had thus far as an organization at Siskin Hospital, and knowing we've still got to stay the course, but what are you most proud of as far as the results thus far?
I really am most proud of the fact that we have not only, for the most part, been able to keep it out of our facility, but we are catching it early from every indication. And even if we have employees that have been asymptomatic that we later on find have had it, as we've done tracing, it's not been passed around. And I do attribute that to the fact that employees here, for the most part, are really following the measures closely. They're doing what they need to do. That they need to take the evidence of how much we've been able to keep it out of our building, take that home with them, and explain that to their families, explain that to others, and continue following those same measures. Because if we've been able to keep people safe here in the facility for the most part, they should be able to do that at home as well.
Any final words of guidance you would have for our associates as we continue to battle this COVID-19 virus?
I would say 2 things. Number 1 is we can't afford to become complacent, stay the course. And number 2 is don't listen to rumors. And if you have questions, feel free to come and ask Kimberly, myself, ask your supervisor. And if they don't know, they're going to ask us. But please communicate. Just understand that we are being super diligent, and we are going to continue to be diligent in protecting everybody, because that's what our mission is. We have a passion for this.
Well, thank you for everything you're doing, Curtis. It is absolutely, I'm absolutely grateful for where we are, knowing we've still got to stay the course and we've got work ahead of us, but we have helped save lives and protect a lot of associates and patients as well by being so diligent with our mitigation plan. So thank you for your leadership. And thank you all for taking the time to learn a little bit more about our ongoing COVID-19 mitigation efforts And thank you for continuing to stay the course as an organization. We will get through this. It will pass. And we've been highly effective to this point because of you. So thank you for that. And we appreciate Curtis and his team, Kimberly Walker especially, and what they're doing to help us get through this together. Because Siskin Hospital will be stronger because of this on the other side of the pandemic. So thank you all.